There's a lot of stigma around migraines still in the general population. You know, a lot of times people who don't experience them will think of them as maybe just a headache, and they don't understand the degree of physical disability that people with migraines sometimes undergo during their migraines. This can put a lot of stress on relationships. Particularly if you have a spouse who doesn't understand how to say, like, that you need to sit in a dark room for a few hours or even for a full day when you undergo your migraines. If you have little kids who really want you to be present and active with them, they may not understand that your migraines are really disabling and may put you out of commission for the day.
In my experience of managing patients with migraines, invariably I always want to make sure I'm also meeting the family members and their loved ones, because I do know that this is not a singular experience. This is really at the minimal is a family, if not a communal experience that's being shared. And unfortunately in that, people are being impacted negatively. So I think understanding that moment and understanding how much they've given up, and that giving up could be giving up positions at work because they just feel like the stress of taking on the next level of responsibility will potentially cause more migraine episodes. Or it could be a decision between a husband and wife, or that having another child, I don't know if I can have another child because of just managing it. And if I'm not able to take care of one child, how am I going to take care of the second or the third child? Right? These sort of have reverberations that go way beyond what we see on a day-to-day management.
I think it's very important to speak to the people in your lives about your migraines and to give them a sense of just how disabling they are for you. It's a very subjective experience, and it's sometimes hard for other people to understand just how bad they can be. You can try to describe the pain in ways that maybe they can relate to, or the associated nausea or the fatigue. If your migraines are controlling your life and negatively affecting your relationship, it really is time to touch base with the neurologist. Migraines can also be associated with depression and anxiety. It's been very well delineated in the literature that you can have migraine-associated depression and anxiety just related to having migraines at baseline. And sometimes the treatments can actually address several things at once.